What's going on, friends and family? I hope this week is finding you well. It's finding me well. I'm finding this week well as well. Anyway, um, so it's 1 week after I got my vagal nerve stimulator put in. Tomorrow is the 1 week mark, so it's 6 days actually. Um, but they took the stereo strips off today, or the doctor took the stereo strips off today. Everything's looking pretty good. I'm progressing pretty well. I just wanted to show you guys the scars since the stereo strips are off. So let's get up close and personal. Get up in there. Scar on my neck, scar on my chest. So you can kind of see. Actually, for a week of after being sliced open, they really don't look bad. I mean, yeah, if I had like that nasty like scar like my whole life, but I mean, within the next year, they're gonna heal up pretty nicely. You can still see, I think 95% of the swelling is pretty much gone down. I'm still like a little yellow here from the bruising, but there's really no pain. I'm still a little sore. If I turn my neck this way, the lead's right in this, wrapped around this vagal nerve here, so it's still a little tight there, and the scar tissue is making it tight. The doctor said about one more week will probably be the basically the tightest, the most stiff the scar tissue is going to get, but that I should be stretching my neck and everything so it doesn't, when it heals up, it doesn't form too stiffly and I can't move. So I've been kind of stretching my neck and doing little exercises. You can still see this, like the swelling's gone down, so you can see the device. It doesn't protrude too much. When I press my chest out, you can definitely like see it pop out, but I don't really like press my chest out too much. I'm not like flexing all the time. So and you can see the scars are a little bit, they protrude as well a little bit. And that's just really because the stitches are underneath, and they're the dissolvable stitches, so they're underneath, and they should dissolve within like a month or two. So I'm not really too worried about ripping anything open. The doctor basically gave me the go-ahead today to get back in the gym. Well, that's kind of how I took it. She didn't give me the go-ahead. She gave me the go-ahead to start like living life normally and getting back into the swing of things. I've been in bed basically for a whole week, just like reading and stuff, and it just like, yeah, definitely recovering from any surgery definitely depletes your energy levels. So yeah, basically what I took it as is get back in the gym and start again. So I did. I went back to the gym today. First day back in the gym. Really, first day doing anything. I went really light. I'm not trying to tear anything open or rupture anything or rip this thing off my nerve or rip my nerve out or rip open any of these incisions. So I just worked out my legs today, and it felt really good. I just, when I got this diagnosis, when I started taking medication, experimenting with medication, especially the dosage of medication and the type of medication that I'm taking at this point. Anyone really with epilepsy or that has seizures that's taking medication for it, anti-epileptics, pretty much knows that, this stuff is like suppressant. This stuff suppresses your cognitive function, your any brain functioning, memory, even bodily functions. This stuff makes you cloudy. It makes you tired, groggy all the time. So at the dosage I'm at, I couldn't handle the amount of medicine that it took to actually suppress my seizures. It was just suppressing my person and my personality too much. So I'm actually still taking the medication. I get the device turned on next week, which is exciting. So I'll let you guys know basically next week what's going on, how I'm feeling with that and stuff. But so I'll hopefully decrease my medication next week. And like I said, just before the diagnosis, I've always been athletic and going to the gym and everything. But after taking so much medication, just like really the one thing that like just staying active, it doesn't really matter what it is. But like for me, just even going to the gym, whether it's by myself or with a partner, just it's something I always looked forward to. When I was taking this medication, it was really the only thing I looked forward to, because it gave me so much energy just in the long run. I was able to clear my mind and take away a little bit of that foggy feel that the medication gives you. So getting back in the gym was a big step for me. It felt great. I've already feel more energy, and this is just day one. So I took it really light today, just did legs, like I said, lightweight, nothing too heavy, and it feels really good. You kind of get knocked off a little bit, but for me, it's kind of all progression from here. And if you think about it, as a progression, even when you get knocked down, knocked off the horse, in the long run, if you're trying to progress all the time, holding steadfast and just kind of making little progressions all the time, which is where I'm at right now, and you get knocked off big one time or one day or 1 year, 2 years, if you're dealing with something bad, you just try to move forward. And it's all about having the mindset. You really learn from things that hit you hard in life, and I think the harder they hit you, like the more you learn from them for sure. So I'm pretty positive right now. My mind, mentally, I'm in a good place. That workout today helped get my mind in a good place. So I'm going to start progressing, moving forward with everything. And I'll let you guys know what's going on. Keep you updated. Next week, like I said, is the week I get everything turned on. So I'll do like a comparison. I'm hoping to get off like at least 350 milligrams of medication. I'm on about 3,000 right now. So 350 a day decrease will be I'll definitely feel it. But he's gonna turn the stimulator on, so I'll have stimulus, less medication, and I'll let you guys know as far as the stimulation, how it feels, how it's affecting my throat, if I can talk. Let you know how the magnets are working, how they work, what they do, and how they help with the stimulator, and I will let you know how things are going. So I hope this week is a good week for everyone out there. Stay strong, keep moving forward, and I'll see you guys next week. Have a good one.